Hi, folks. Welcome back. I'm Chris Lethem. This is The Economy and You, and today we have a special guest. Our guest today is former candidate for the Senate, Cam Cavasso. And today we're going to talk a little bit about some of the weird and wonderful things going on with ObamaCare and what's going on with the next presidential election. Welcome to the show, Cam.
Thanks, Chris. Well, glad to be here.
Nice to see you. You're looking great.
Thank you very much. The economy. That's our subject.
It's all about the economy, right?
Making a living.
Economy. Well, you know, we've been chatting a little bit about since our campaigns.
Oh, yeah.
We've been talking about some of the interesting things that have been going on and some of the challenges that we're facing at our Hawaii legislature. We're dealing with lots of really interesting issues. As you know, the rail seems to be a big issue, continues to be an issue, the overexpense or the overruns on the rail. And I'm not getting any sound, so I just want to make sure we're working okay. Are we working okay? Yeah, all right, we're good, okay. So, anyhow, we're running into lots of interesting issues. You just came back from?
A trip to D.C. to visit with a few of the U.S. senators there and some of the new senators and get a handle on what's going on. Actually, more to bring a closure to our campaign for the U.S. Senate. We got help from out there. I was running against Brian Schatz. Obviously, he won. He's back there.
You think he's got the skin for this game?
Well, he's got the skin for it, but the trouble is that he and President Obama, I believe, continue to lead our nation in the wrong direction towards socialism, away from individual responsibility, toward a lack of family control. And I'm glad to see that we now have a Republican majority in the U.S. Senate and in the House, and I'm hoping that this next election will give us a Republican president that's a whole lot better than the socialistic ones that is there now or that are running on the Democratic side.
Well, you know, the interesting thing is that we have now, I mean, they talked about all the debt that we ran up under the previous Bush administration, right? There was a lot of debt that was ran up. Of course, we're in the middle of a wartime situation, but then, and that was like a record amount of debt for this nation. And that under Obama, we've now tripled that debt. And so we have mired ourselves into debt. You know, and I remember when I was a kid, there was a little expression that I was told. It goes like this. If you find that you've dug yourself in a hole, stop digging.
Oh, yeah.
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 And I don't know that we've stopped digging yet.
No, and there's another saying that said that the debtor becomes slave to the lender. And we are now becoming slaves to China, to other international governments, to the banks.
Yeah.
We are entrapping ourselves as a people, and it is a very dangerous place to be.
You know, and you consider we are carrying a lot of debt. We're carrying it at very low interest rates. Like the interest rates right now that on treasury notes
artificially
and bonds
low. That's right.
Are artificially low. If those spike back up again, and we have to continue to borrow money at higher interest rates, okay, doesn't that also create a real problem for not only for us but for future generations?
It can put us in a place where the interest payments are higher than our income.
Yeah, not a good place to be. Yeah.
No, if you run a family or a business, how can you run a business where your interest payments are higher than your earnings each month? You are headed for bankruptcy.
That's bad news. Yeah. And we look at Greece. You know, Greece has buried themselves in debt, and now they're having to get through this whole quagmire, this austerity program that was implemented by the EU. They're finding themselves in a world of hurt because they ran a very socialistic government.
Yeah.
They were borrowing to the nines. They don't really they have sort of typical European situation where they only work so many months out of the year. They have a lot of holiday time. You retire, I think, at 60 or something like that. I mean, the retirement age is very low, and you know that's great. You know that's great for a while, but eventually you got to pay the piper.
You do. You know, Greece used to be a nation that stood on its own. It used to be one of the leading nations in the world, and as it's gone more and more socialistic, it's lost its character. It's lost its initiative, and now they're just depending on their government and their neighbors' governments to provide for them. They won't make it either.
Yeah, you know, eventually they're going to have to fish or cut bait.
Yep.
They're either going to have to stay with the EU, and if they're going to do that, they're going to have to implement programs that allow them to either through raising taxes or promoting more business. They're going to have to do something to generate the revenue to pay back the money they owe.
Yeah, we don't want to go down that way. America was built on initiative. It was built on on free enterprise. It was built on character. It was built on small business. It was built on the idea that any man can go out and start his own business, start his own farm,
right.
create his own, invent his own thing, and go make it. And that there is no limit to the income. And there should be no limit to income for Americans.
Well, that doesn't sound like America today, does it? It's changed a lot.
It has changed a lot.
Yeah.
It's the government, the systems we have are discouraging the initiative. But you know, it's interesting that in Hawaii, it's the immigrants that show often the most initiative. The Filipino immigrants that start their own businesses, go out and make it happen. That put 2 or 3 families in a home and work together. And traditionally, that was the same way it was when the Japanese came before the war back there. And
I've seen that with the Vietnamese immigrants that come here as well. You know, they send their kids, and they really value education. I mean, education is everything.
And the Portuguese.
And the Portuguese.
You know, they used to call me a Portuguese in high school.
Is that right?
Although I'm Italian.
That's because you talk a lot, baby.
Yeah,
I don't.
Because I have plenty of Portuguese.
That's right.
You know, we're a conglomeration of people who've come here for opportunity.
That's right.
And we need to create further opportunity, open the doors, not tighten the regulations, loosen the regulations, and defend free enterprise, defend the right to work, defend the right to set our own pace.
Well, you know, it's interesting. As you know, I worked in the technology space. I'm a software engineer. I used to do investments for a living. But the thing, one of the great reasons I think we're striving ahead with technology is we haven't created artificial encumbrances that mitigate our growth in the technology space.
Right. Yeah.
You know.
And I work in finance.
Yes.
And I see. I don't work with the banks. I work in the private sector, and I work with companies that create opportunity and create finance, and it's not leverage finance.
Right.
I work with insurance companies that when they loan something out, they have $1 of equity to loan out with. We put ourselves in a dangerous position in the banks as well. They're allowing the banks to loan $10 for every $1 they have in equity.
Well, this is all part of monetary policy, right? In other words, what we're trying to do, you know, and it's kind of an interesting thing talking about monetary policy is we worked very hard. Under this program, the QE program, we were printing money like it was going out of style. We used the Federal Reserve to buy back our debt. This created most people, we would refer to this as quantitative easing. Japan has now implemented quantitative easing to the second power. Europe is now implementing quantitative easing. China, of course, has artificially devalued their currency as well. We all know that. That's, of course, why China turned into sort of the manufacturing base of the world, is because they artificially devalued their currency so that they could compete against the rest of the world's manufacturers. That seems to be the game.
Dollar has been the strongest currency in the world. It's been the currency used for oil, but we're in danger if we keep.
Well, look what oil prices are now. I mean, I think today it was at $56 a barrel on the price of oil. So, I mean, we printed so much dollars. There's so many dollars floating out there in the system that the dollar has been devalued. Of course, that reflects in all the currency or all the transactions for oil, because those are all done in U.S. dollars, correct?
They are.
Yeah.
But getting back to the idea of oil, I'm gratified that America has expanded its own exploration for oil. The natural gas that's come. The American entrepreneur is making things happen in the area of oil, and we should be self-sufficient based on that entrepreneurship.
Absolutely. You know, it's a political issue at some level. You know, we want to be environmentalists. We want to be good stewards of the planet. But at the same time, if we find that we are in a place where we're buying oil from people who are not our friends or not our allies, but in fact are our enemy, you know, that mitigates our power.
You know, I may be bouncing all over the place.
Yes.
They're talking about the government regulations that are the administration is trying to discourage the pipeline. You know, they're going to force trucks to take out all that oil, and trucks are more dangerous than a pipeline.
And trains.
Railroad is more dangerous than the pipeline. Their effort is to discourage the entrepreneur, discourage the inventor, discourage American industry, and we don't need to do that. They're saying they want to protect the environment. We can do both. protect the environment and taking care of business and our economy is vital for this future of America.
Well, you know, one of the things I saw on the internet the other day, we're talking about what we could be doing as a country to be innovative. And one of the things I've seen is solar panels that you can use to build out highways. Solar panels, they're like I don't say they're glass, but they look like glass on the surface, but they're hexagon shaped. They're 8-sided like a stop sign.
Yeah.
And they fit together. They use amazing technology. And by the way, this was developed by a husband-wife engineering team who developed this technology. Now, I don't know that we have to put it on the highways, but you think about it in your driveways, you think about it in supermarket parking lots and places like that, where you can have solar power being generated. You know, there are opportunities to implement all kinds of technologies, but we don't necessarily need to put ourselves in a predicament where we're dependent on foreign oil. I just don't think that's good for America. That doesn't allow us to assert our power and authority.
You're right. You're absolutely right. We must not be dependent on those who may be hostile to our people and our future.
That's right. That's right. You know, and I think that's one of the great things about the fact that we're now able to use fracking technology. Now, I understand it's not perfect technology. It does have its downside.
You know, it wasn't too many years ago. We didn't have it at all.
That's right. That's right.
Which is another thing, that we are people who have the opportunity. We can invent things. There is no limit to where we are going, and there should be no limit to the resources and our proper and careful use of those resources.
Now, you said something earlier that I want to mention. You know, and you know me, I'm an advocate for building and supporting stronger family units and not invading arbitrarily into the family unit by government. That intrusion is where it's unnecessary. I think we should be doing more to support brittle families, young families. We need to move away from exploiting them. We do need to do more to support families and parents. You know, we have a 2-girl for 1 guy in our college systems today.
I didn't know that.
We have 2 girls for one boy, yes. Young men are failing in this nation in a big way, and it's going to be a problem. Just like the Chinese are experiencing a problem because of the one-child policy, where we have young men that aren't making it into the universities. And it's great for the women. I mean, I have 2 daughters, so I'm a big advocate of girls going to college and getting an education. But we also need our young men getting a solid education and being there and taking and being part of the solution set. And they're not making the grade. And it's not a monetary issue. This is not an issue of money. They're just not making the grade. They're not doing what they need to be doing in order to achieve academic success. You're covering
leaping into a whole new realm of where our media and our government seems to demasculize young men. We're taking away the strength of our young men.
Well, there's a challenge with that.
Yeah,
and here's the thing. When you have young people that are engaged and goal-oriented in achieving things, you know, that opens up all kinds of opportunities, because as the old saying goes, luck goes to the prepared, right? But that means they need to be prepared, and we're not doing what we need to be doing. And honestly, I think one of the big challenges is that fathers are not seen as a solution. Fathers are not being brought into the equation as part of the solution to ensure that their children are achieving their highest potential.
And when we look at the record of those who are in trouble, those who are in prison, those who are failing in schools, often it's because there's no father at home. Those families with a father at home, their sons and their daughters both are doing much better in all fronts. So fatherlessness, the degrading of the marriage and the father figure as a responsible person in that family is ruining us.
Yes, and I don't care if the parents live together if they don't. But you know what? Even if they aren't living together, but the fathers are engaged in the parenting process of their children, both parents. And I don't want to say one versus the other. We need them both. Both have an important and unique role in their children's lives. And it's, you know, parenting is a time-intensive process. It's not money-intensive. It's time-intensive.
But it's the young men that need the father. I mean, young women need them as well, of course.
Well, I'll tell you why I think fathers are important for daughters, because fathers provide an innate protection for their children, especially their daughters. And I think
perhaps an example for their daughters to look for in a good man, too.
That's right. There you go. That's right. Exactly.
I have 3 daughters, and and
Yes.
a couple of granddaughters as well.
And you know what? I like the fact that, you know, one of the things is that when you're a father and you're an active father, you set a pretty high standard. And if a young man doesn't muster up, he gets called out. But here's the good thing: if a young man gets called out and he goes, "Look, I didn't make the standard," then I know I need to do something about that. I'm motivated to do something more with my life, to achieve more, to be that person.
Yeah.
That the young lady would respect and look up to.
And one of the values I look for so much is a family that looks to multi-generations, setting a legacy for my sons and my sons' sons and my grandsons' sons.
Yes. Well, we're going to go to commercial. This is great. I'm really glad that you're on the show today. I'm Chris Lethem. This is The Economy and You, and we'll be right back. Stay tuned for more. Thank you.
Here's the deal. I'm Jay Fidel. I'm the host of Hawaii, the State of Clean Energy, which is the Energy Policy Forum's program on Wednesday. That's how we call Wednesday Energy Wednesday. We call it Energy Wednesday every Wednesday. Are you surprised? Okay, and we try to get guys like Jim Alberts here from Hawaiian Electric who can tell us what's really going on in energy. We want to be informed. It's so important. It's the most important initiative in our state. Clean energy is major, okay? And that's why we cover it on this show. That's the deal. What do you think, Sharon?
I think that's great. That's why we're here every Wednesday from 4 to 5, and we hope you all join us so we can hear people like Jim coming on our show and co-host Ray Starley from Hawaii Energy.
Okay, Jim, you've been here today. You've seen this. You heard what she said. What do you think?
I think it's a tremendous opportunity for people to come together and talk about the issues. Oftentimes, there isn't a good forum to bring these key issues out into the public, and this is a tremendous way to go about it. And the activity of this show is essential to keep talking about energy because, as you said, it's such an essential part of our lives that we need to pay attention to it and we need to think about the future.
Okay, Ray, your turn.
Well, this is a special time in the history of Hawaii where we're making some pretty radical changes in the way we use energy and generate energy. And this show is the one place you can count on coming to every Wednesday and hearing something about the latest issues that are on the table, being discussed, that will affect us all going forward. So come join us, and if you have some ideas you want to share with us about energy, give us a call and let us know. We'll put you up here and let you talk for an hour. So come see us.
Thanks, Ray. Thanks, Sharon. Thanks, Jim. It's great to be, from Think Tank's point of view, it's great to have this show. We love the show. It's our most important show. So come around and listen to us 4 to 5 on Wednesday. Thanks a lot. Bye.
Aloha.
Aloha.
Hi, we're back. Hi, this is Chris Lethem, and this is The Economy and You. Today's guest is Cam Cavasso, a former candidate for the state senate who ran against Brian Schatz, and we're talking about a lot of things related to family and finance, and we're talking about what we need to be doing to motivate young people and keep them going. Cam, we're kind of talking about this, but we actually kind of wanted to talk a little bit too about ObamaCare today. And talking about ObamaCare, you just came back from Washington, D.C. I probably had a chance to talk with a few people about some of the things going on, and you've had some personal experiences.
I did.
Yeah.
Let me just share my personal experiences first. Forgetting ObamaCare for now, just with the American medical system. The American medical system is really the best medical system in the world. It's proven to be that for 100 years or more. And it's taken good care of my family. When I wouldn't be here if it weren't for good doctors. I had an infection, blood poisoning when I was a youngster.
My goodness.
And it was only because of our medical system that I'm alive today. And it's been the same way with other members of my family.
Mm-hmm.
And so I'm thankful for our system. And I appreciate the doctors. I was working with some today. But I'm concerned that the system that's coming down on us is going to discourage doctors. It's going to prove to cause a doctor's shortage. It's going to hinder, particularly our neighbor islands. It's going to hurt Hawaii. We had a good system here. 90% of our people were covered by a system we had. And now we've come in here with a connector that took $120 million to do nothing.
By the way, I would have loved to have been the programmer on that project.
Oh, you know,
$120 million to build a website. I mean, that's crazy. I mean,
take
who'd have thought?
$120 million and pay for the medical care for the 10% that weren't covered for one reason
Yeah.
or another.
Yeah.
I mean,
It's
and now
phenomenal.
we're trying to continue the system, a failed system. I think that we had a number of people sign up, but the end dollar was it cost $52,000 per person to sign up for the connector in Hawaii.
Really? That's crazy.
It is absolutely crazy.
And if you
It's
consider-
government-run healthcare, and
Yeah.
we can't do that.
Well, we've seen what's going on with Maui, you know,
Yeah.
and the challenges that we're having there. And of course, with Maui, one of the challenges that we're having is now they want to bring in private management. But of course, the union people are saying, no, because we're public workers, we're not gonna allow it.
You know, there's a private sector cares, and
Yes.
individuals care. And when people are in competition, when doctors are in competition with doctors, when hospitals are in competition with hospitals, with the idea that they're supporting their people, they do better. Iron sharpens iron, competition sharpens us. And when we put everything under one umbrella and say the government is going to make the decision, a bureaucrat, who, by the way, seldom has medical experience, is going to make those decisions for everyone, it doesn't work. And that's what Obamacare is forcing down on us. And I believe that our U.S. Senate and Congress is going to stop much of what's going on. I think there's a decision coming out before the Supreme Court here shortly where saying the president has overstepped his bounds, and they're going to have to redesign our health care system, and we need to design it on a private model.
Well, and that concerns me because I don't know how many people out there, I don't know if you folks would like to have a bureaucrat making your decisions about your health care, how comfortable you would feel with that. I personally don't know that I would be particularly happy with that or even feel safe that these people are making good choices.
You know, we just, my wife and I just went through a fairly bad experience last year. She was told she needed to sign up on the government system. She didn't. Because she didn't, she lost her private health care. She was dropped off of the health care system I had because they said she had to sign up for the government. She's a year older than me.
Oh.
And she had to sign up for Medicare. She failed to sign up for Medicare, so they dropped her from our private health care. So we were uninsured for a year, my wife was.
Why?
And then now, fortunately, I've got her back now in another private health care program. But in the meantime, I learned that because if she had signed up for Medicare, that she wouldn't, and she had to go for special surgery, the surgery had to be approved by the government bureaucrats in Medicare.
So that's already in play.
That's already in play.
That's already in play, wow.
And so if they didn't approve the surgery, and my wife and I felt that it was in our best interest, in her best interest, to do the surgery for her long life.
Right.
We would go to the doctor and say we want to pay for it ourselves. But what we learned is that once it's that procedure is declined by Medicare, and if you're connected to Medicare, if the doctor performs that surgery for you at your own expense, he can lose his license. Therefore, Medicare is now in a position of dictating what programs, medical procedures you can and cannot have. And if you choose to get them on your own privately, the doctor who does it can be sued.
That's disturbing.
It is very disturbing.
Now they would be sued. They would be sued by Medicare.
By Medicare,
Medicare.
Their license would be in jeopardy because they're doing a medical procedure that Medicare said they should not do, and because they're doing it at private expense, they're threatened. So we are putting our doctors in a very difficult position. Doctors
There's such a squeeze.
Are afraid
Yes.
of doing things. They're afraid of taking a chance, and therefore they practice defensive medicine. They
Yes.
over-prescribe the tests, and
You know, we just talked about this last week on the show. We talked about the fact that doctors do practice defensive medicine, but one of the issues too, of course, with defensive medicine is, as a doctor, you want to prevent yourself from being sued because you were potentially negligent because you didn't perform some test that might have caught something that was operating outside the bell curve, you know, of statistical, you know, likelihood that you would have gotten ill from this particular thing. Now, of course, we're using lots of tools these days to help mitigate or help doctors diagnose patients. You know, we have great software.
Good
for this
things,
kind of
but
thing.
you know what? I was scheduled for an MRI tomorrow.
Uh-huh.
It took us 2.5 weeks to get scheduled for that MRI. I'd had a back issue. Fortunately, I'm okay now, and it turned out it wasn't needed. But it was another example of the government has said that you can only have so many MRIs in the city, and they have it's government rationing.
Yes.
And it causes the price to go up, and it takes away the freedom of a patient, of a family, of a doctor, of a hospital, of an American, of a Hawaiian.
Now, do you feel like, I mean, what I've seen with ObamaCare is I have not seen any major tort reform. I've seen some minor things come down the pipe in terms of pain and injury, or pain and suffering limits and things like this. But do you think we need to maybe take a look at the liability or the tort reform on some level to mitigate the cost? Because isn't that a big, I mean, the cost of insurance,
absolutely.
isn't that a huge part of the problem?
Part of the American problem is our legal system, unfortunately, that is awarding large settlements and encouraging lawyers to sue doctors so that doctors must carry huge liability insurance premiums.
Yes.
We've become a litigious society, and it is a problem, and
Well,
we should be limiting it.
You know, we have 75% of all the lawyers in the world are in the United States. Of the whole world. The rest of the world gets by with the other 25%.
You know, their common sense is when, you know, it is right that if a mistake is made, that compensation be made for that mistake, that the finances be awarded to fix that mistake.
Yes.
And take care of that person until they're back on their feet.
Yes.
But instead, and that might cost $100,000, but instead the lawsuits are awarding $1 million.
Right.
And half a million is
Or
going
more.
to the, or more,
Yes.
and the attorney's fees are huge. So
Yes.
I'm on track with you. We absolutely need tort reform, and unfortunately, it is not part of the
It's not part of the
President's healthcare system.
ObamaCare.
It
Yeah,
is
it's
not part of
Obamacare. You know, I know in the UK they do have laws where if a doctor is practicing what they call safe harbor or practicing best practices, I guess that's the term, best practices. Let me use the right term. Then they are free from litigation. Now there may be a settlement, but they don't have to go through attorneys. I mean, they work to get that patient back on their feet again. I'm not saying the British healthcare system is the best in the world. It is socialized medicine. I mean, we do acknowledge that. But, you know, there are some things that you can learn from other people that they are doing well.
And there's some things that are good in the Obamacare. I'll name one thing that's good on it, and I believe that it is appropriate that with families staying together longer, a good part of that law was that a 25-year-old that's still living at home with family should be able to be on that family package.
Yeah, why not?
That's a good thing.
That is a good thing. It's not forced, it's not required, but, you know, if your child, say, they went into the military, well, then they're covered. It's not an issue. But if they're still in college or they're working on a master's program, you know, they can still be covered by the family plan.
That's right. And we should, now I don't know if this is in Obamacare, but what should be in the system now is that, in fact, this is in the proposed programs from the conservatives in Congress.
Okay.
What we should be able to say is that your medical care program, your insurance is portable. When you move from employer to employer to employer, you take it with you.
Take the plan with you.
When you're between, you can pay it, but you take it with you. The system that we are having is forcing people off of that and onto government. No, we don't want that.
We don't want that.
We had a good system here.
We're going to take a break. We'll be right back. Stick with us. This is Cam Cavasso, folks. And he's got lots of great things to talk about. We are talking a little bit about Obamacare. He's got some great ideas. Stay tuned. We'll be right back. Mahalo.
Hi, Jay.
Hi, Keith.
My name's Keith Bettinger.
I knew that.
And I'm the host of Think Tech Asia.
I knew that too.
Here on Think Tech.
Fabulous. You got a great show going, Keith.
Thank you very much. And for our viewers out there that are interested in Think Tech Asia, it airs every Tuesday from 4 to 4:45, and it can be accessed online at thinktech.com.
Yeah, so what kind of guests you like?
Well, we have a number of guests from academia, from practitioners of international affairs. Sometimes we have military officials. Sometimes we have public officials on the show. And our goal, we try to talk about current issues in South Asia, Southeast Asia, East Asia, and Central Asia, all throughout the Asian realm in more depth than you would find in traditional mainstream
That's the
media.
difference, isn't it?
Exactly.
That you're reaching out beyond what ordinary news media would do.
Right.
And that's why we like you so much.
We're trying to provide a thinking person's perspective, an intelligent perspective on what's going on, and we're both sides of the story, or even when there's more than two sides, we try to cover every angle. And I think that that's one of the big benefits that we provide here at Think Tech. Is it's a really innovative source of educational programming for the people of Hawaii.
You're great, Keith. You are a great host. You got a great show going on. I watch it every week.
Thanks very much.
Why don't you guys watch it every week too, okay?
4:45 to 4 to 4:45 every Tuesday.
Hi, folks. Welcome back. I'm Chris Lethem. This is The Economy and You. Today's guest is Cam Cavasso. We're here at the Think Tech studio over at 900 4th Street Mall. 900 4th Street Mall, Pioneer Plaza building, in the basement. Yeah. By the way, just so you know, this wall behind us is actually green. And I always wanted to mention that. So we have to be careful what shirts we wear, right? So Cam and I both wore the right color shirt today, so we don't look like we're part of the wall. But we want to talk a little bit about, we've been talking about ObamaCare, and also I want to talk a little bit about maybe some of the things that's going on with Congress, and maybe some of the things that we need to be looking at better so that we have good health care and we can continue to have great health care in this country.
Okay, one good thing that happened in Congress this week,
Uh-huh.
and it's recognition that Medicare is cutting the doctor's compensation down to the point where his cost of being in business, his cost of insurance, his cost of staff
doing
and everything
paperwork
is,
oh my gosh, yeah,
is working to the place where he's working for free.
He's not making any
Or
money.
not making enough to survive. And
Yes.
so why would that doctor go to Maui and work in the Maui Memorial? Why would he work here in Honolulu? Why would he go to Kauai? Because
It's for the love, baby.
yeah.
It's for the love.
He cannot. So
He
so
can't,
Congress did
that's
a good
right.
thing this week, and
Okay.
that's they stopped the slide and they upped the compensation allowed to doctors by 20%.
Okay.
And that was both the Democrats and the Republican initiative.
Uh-huh. Uh-huh.
But Medicaid needs a whole lot more work because the direction that ObamaCare is taking it, we need to take it back to the private sector. The ObamaCare is taking it in a direction where there's going to be ration care.
Yeah.
Where they're literally driving the cost of medical care up so high, and then they're deciding, government officials are going to decide who gets the medication, who gets it,
Yeah.
which is dangerous for the handicapped and the elderly. Because
Mhm.
now suddenly you have rationed care.
Yeah. Well, you know, one of the things too, and I just mentioned this off air. We were talking about what they call the billing codes. You know, we were going from ICD-9 to ICD-10. We've been using ICD-9 for the last several years. There's something like 17,000 billing codes under ICD-9. You have to go to school. You have to learn billing codes. I think it's like a 2-year school. We're going to ICD-10. ICD-10 has 70,000 billing codes.
And
it's crazy.
And the billing codes are not geared towards the doctor's language or his care. So they're telling the doctor he has to take his time to enter these billing codes in the computer.
And he has to get them right.
And he has to get them right,
He has to get
because
'em right.
if
Yeah.
he gets them wrong, he doesn't get paid.
That's right.
And if he gets them wrong, the government says, no, you can't do that. And he said, well, wait a sec. I know what I'm doing. I've been taking care of this patient. He needs the surgery. They said, no, you can't do that because you entered the wrong billing code in the system.
Yeah, so we're not going to pay you. So you have to fix it. But of course, that means you have to have staff who now have to know more billing codes, have to know more. Now, I'm not saying you have to know all 70,000, obviously, but you do have to know the billing codes for your period. And of course, that takes time to gear all that up, which of course is great for Medicare. That means they get to sit on your money, the doctor's money.
And when it's all
Yeah.
when it's all computerized, I've spoken with doctors who
Uh-huh.
say that the old system they have, each visit, the last visit would be on top of the next one. Well, under the new system, it's all based on billing codes, so they don't know whether this was for a visit 10 years ago or for the visit 2 months ago. Really what they need to do is have a system where they've had it for 100 years,
Mm-hmm.
where the last report is on top, but the government program's not allowing for that. So unfortunately, I work with a private doctor
Right.
who still has written records. So when I go in there, his written record is, okay, here's where you were the last time, what was the problem? Well, I go into the hospital where it's computerized, and they don't have the ability to personalize it. They don't have the ability to know what the situation was in order of it.
Well, the thing is we are moving toward, electronic medical records. Of course, now if you're a doctor, that's an additional expense to you because these systems are not cheap. There may be some free software out there, but I think by and large you have to pay for it. And they need to be able to integrate with the doctors, with the hospitals.
But to solve the government system,
Yes.
and you're talking about all those codes,
Yes.
whereas a doctor, I can dictate into my iPhone today. I can dictate a message in my language about what's going on. Why can't we let the doctors do that? The government's taken away control, not even allowing them to dictate exactly what they did. They're telling you put in the code because you got to match our system.
Yeah.
It's not good.
Yeah. So I think, you're right. It does take away sort of the personal touch of good medical treatment. So what else can we be doing?
Let's let the doctors design the system. Let's let the medical people design the system rather than the government.
Yeah, well, they're the primary stakeholder. Well, we're the primary stakeholders, I guess. Doctors are stakeholders.
Hospital
but
and
yes,
patients.
Yes, that's right.
Individuals.
Yeah. So, looking at all of this, and we did talk a little bit about tort reform and maybe figuring out ways to reduce the costs of insurance. But we also know that insurance companies reinsure with other insurance companies like Lloyd's of London and other organizations, but they're reinsuring internationally. They're not just reinsuring domestically. So my question is what is that costing us? And then every time you have a reinsurance, there's a commission to an insurance agent somewhere. Back I think it was about 20 years ago, Lloyd's of London ran into a huge problem because what they were doing was they were reinsuring each other, of course generating lots of commissions by reinsuring each other over and over again, but it created an insolvency problem. So one of the concerns that I have also is, are we creating a system just like we did with the loan guarantees where we may be creating a future insolvency issue for ourselves because we're not making sure that we're managing all that sort of hoopla that's going on in the background. And I know this because I actually designed some software for this for HMSA many years ago, where they were doing reinsurance. And then what happens with reinsurance policies is they often get declined. So you had a catastrophic issue, you send off and say, hey, look, you're supposed to cover that because it's a catastrophic illness. We've reinsured ourselves to protect ourselves. And then what happens is they get declined by the reinsurance company, the reimbursement. So these are all the other issues that probably need to be addressed as well, because it's not always. Sometimes what we see is what we run into face to face. The things that we.
I work with a private life insurance company in this case, and the life insurance industry is private. It works well, and I. In favor of the government enforcing standards as far as not allowing cheating or deceptiveness,
right?
But not restricting inventiveness. And reinsurance companies can be very inventive.
You got a lot of smart people working for insurance companies, don't they?
And so, Chris, I tend to encourage less government intervention in insurance and more freedom for private insurance companies to develop that. But the government is there to make sure that they meet the contract obligations and that they're transparent, not deceptive.
Yes. I guess that's part of the challenge too, is because there's a lot of things that go on with insurance companies that we never are privy to. You use mortality tables, you've got actuarial tables, you've got experiential data, you've got all of these things. And then of course, demographically here in Hawaii, we have our own unique challenges. We are probably as much or more diverse than any other state in the nation. We have people coming from all over who come with all kinds of genetic anomalies based on where they come from.
Yeah.
And the question is, are we in fact doing a good job here in Hawaii? Are people getting good health care here?
Yeah, for the most part, Hawaii has been the leader in the nation in getting good health care, and ObamaCare is messing it up.
Okay.
And the forced governmentization of the programs, the privatization, working with private companies and private employers, and HMSA has done a good job. I've had good experience with them. Kaiser has done a good job. The private companies have done well. And also say that risk is an individual matter. Some people want to take more risk than others. And if you build a place where you have the ability to take a risk and say, you know, I want to be insured for the catastrophic, but I'll take care of my own smaller, that will restore competition back to the medical practice.
Well, I think that's, you know, I think that makes good sense, because here's the thing, you know your own situation, right? And when you're young, you probably don't, well, when you're young, generally you don't need as much health insurance, and you don't need to have such a low reimbursement, because you seldom go to the doctor. At least in my case, when I was younger, I was working out, I was exercising, taking care of myself. I didn't really feel compelled, you know, I needed that catastrophic coverage in case something happened, like it was an automobile accident. But I wasn't going to the doctor every month or
That's
every
right.
couple
And
weeks.
the young person on the camera right now should not have to pay an insurance premium that averages to pay my insurance premium at 56 or 66.
Right, right.
It's, you know, we should give them, the young people, the opportunity to establish their own risk and build their own finances and not be forced into government programs either. Let them stand on their own and experience going to the doctors and paying for it themselves and know it. And let the doctors recognize it. I was sitting before a medical person earlier today evaluating whether I wanted to go through a procedure or not, evaluating it and looking at the dollars. And we made a decision, no, we're not going to do it this year, next year, or the year after. It may be a 5-year, 5 years in the future. Let's give our people the freedom to communicate on dollars and cents on the economy. This thing is about the economy.
It's about the economy.
And let's let competition come back into the medical, into
well, yeah, I
the
think
family.
So. I think competition is good, but and I think one of the things that you said is really key is that we do need to provide within the structure of the law opportunity for people to be creative,
absolutely
to come up with new solutions and new ideas. You know, and this actually not just in the medical field, in all aspects of government. Yes.
In every single field.
You know, we are doing amazing things. Technology isn't, you know, doesn't run like this anymore. It's running it like this. I mean, it's just amazing the technology we're developing on a daily basis. Biotechnology, cures for cancer, things that it's because we have these little upstarts.
There's no limit to where we can go as a people in a state.
Yes.
And if we will open the doors to invent, give our people the freedom to grow and make things happen, to be inventive, we'll do well.
We do well, but you know, we also need to make sure our kids are getting the kind of education so they can be a part of that solution set. And that's why, going back to what I said earlier, we need to keep both parents engaged, working together, make sure our kids achieve their highest potential,
because
and
the family,
contributing.
Do I agree? The family is the foundation of our community.
That's right.
I've heard it said, as goes the family, so goes the state. As goes the family, so goes the nation.
High five.
So true.
High five. All right. Okay, we're out of here. This is Chris Lethem, and this is The Economy and You. I look forward to seeing you next week. It's been a great show having you today, Cam.
Thank you, Chris.
And we look forward to see everybody next Wednesday, 3 o'clock. And again, The Economy and You. Look forward to seeing you.